A very good morning to you. Thank you so much for staying. This is MBCI TV ambapo tunabadilisha maisha by the grace of God, and I'm really excited to have all of you here. Thank you so much for choosing to watch MBCI. We say this is where we transform lives by the grace of God. So from wherever you're watching us from, thank you so much for being here. This is Afya Clinic, where we talk about everything health. And I had asked earlier, maybe before we got to what were Facebook and YouTube, what is that one thing that you are thanking God for? We talk about health each and every other time. And we said that we've seen, even from the Word of God, that health is very important. You could be having everything, but if your health is not at a good place, you might not be able to do what you need to do. So that's why we get to talk about these issues that are very, very important to us. And today, we have Dr. Sylvia, who will be helping us unpack the condition that we are talking about today. So what I'll do is, Ukiona, you know what we're talking about. Today we're talking about asthma. And asthma is something that you've probably just heard from people, or you've actually seen people who have the condition asthma. So either people who are close to you or people who are not close to you, or it could be you yourself umekuwa na ile condition ya asthma. So we need to know more about what asthma is. What are you supposed to do mtu akikuwa na asthma hata karibu na wewe? Do you have some tactics? Do you know what exactly you're supposed to do to help them live? Because that's a very critical condition right there. So that's what we'll be talking about today. So karibu sana. I'll be able to go through some of your feedbacks, whatever you've sent already. And I know that we had asked a question earlier, so we'll be going through that. But for now, I'd love for us to just go through the In History segment to get to understand a bit more about asthma before we get into the topic of discussion.
The term asthma itself comes from the Greek word panting or short-drawn breath. Hippocrates, a famous Greek physician, mentioned asthma as a distinct respiratory condition in the 5th century BCE, attributing it partly to environmental and lifestyle factors. Roman physician Galen later elaborated on its symptoms and linked it to airway obstruction, setting the foundation for future medical understanding. During the Middle Ages and into the Renaissance, asthma was often misunderstood and treated through humoral therapy, which emphasized balancing bodily fluids. Treatments include bloodletting, herbal remedies, and avoidance of certain foods. In the 19th century, the medical science advanced, and asthma was increasingly seen as a condition related to the lungs and bronchial tubes. Inhalation therapies became more common, including the use of bellows and early forms of inhalers to deliver medications like epinephrine and stramonium, a plant-based remedy. In the 20th and 21st century, asthma began to be more understood as a chronic inflammatory disease of the airways influenced by genetics, allergens, pollution, and lifestyle. The development of bronchodilators in the mid-20th century and corticosteroids in the 1970s revolutionized asthma management. Modern treatments include inhaled corticosteroids, long-acting beta-agonists, biologics, and improved diagnostic tools. Public health campaigns and global health guidelines have further improved awareness and control, although asthma remains a significant global health issue today.
So that's it about the history of asthma. And I know that you've gotten to learn a thing or two. Nilikuwa tunaona doc akifanya perfect. So that tells you that hapo tumefanya kazi mzuri. So Faye, asante sana, together with the whole team. Thank you so much for that particular segment. Now, we get to introduce our doctor who's in studio already, and we'll be talking about asthma. So if you have any question that you'd love to ask, our numbers are very open. So that's 0721 105 105 on WhatsApp, 23814 or SMS code, which is absolutely free of charge. We're live on Facebook on MBCI TV Facebook page. We're live on YouTube on MBCI TV official YouTube page. So on all those social media pages, we'll be able to get your feedback and we'll be happy to hear from you. So we introduce Dr. Sylvia Mukami. Good morning and welcome to Afya Clinic, where we bring you insightful conversations that promote your health and your well-being. Have you ever seen this? Or perhaps this? these are common tools used by people living with asthma, a condition that affects millions of people worldwide, including right here in Kenya. Asthma can be controlled, but only if we understand it better, what it is, what triggers it, and how best to manage it. Today, we are privileged to be joined by Dr. Sylvia Kairu, the head of clinical services and governance at Valley Hospital, Nakuru. She brings with her a wealth of experience in patient care and hospital leadership. Dr. Sylvia will be helping us unpack the realities of asthma, its management, and the steps we can all take to breathe easier. Karibu sana to Afya Clinic. I'm your host, Rachel Kahogo. Doc, karibu sana.
Thank you very much.
Thank you so much for being here.
I'm very happy to be here today.
Yeah.
And like you said, what am I grateful for this morning?
Mm-hmm.
I'm grateful for the gift of health. Correct. Yes.
Amazing. I love that.
Yeah.
So we're with Brenda here just before we got to introduce the topic of discussion.
Yeah.
And you talked about why health is very important and how isipokuwa karibu na wewe, you might not be able to understand that it's such a great gift. And I gave an example of during COVID, how we saw people suffering to even breathe. Yeah?
Yeah.
And people were buying oxygen. We were like living in a movie. I was just thinking, okay, guys, hold on. Why do we need to buy oxygen? Yeah? Something that we just, breathe kawaida.
Yeah.
So I absolutely agree with you.
All right.
Karibu sana.
Thank you.
Thank you so much for being
all
here.
All right. I think we'll get into the topic of discussion for today.
Yeah.
And this is asthma.
Mm-hmm.
And I think it was a very well thought out topic. Mm-hmm. It's time to demystify and align with the facts of what is asthma.
Yeah.
I can maybe start by giving a few statistics worldwide. Around 300 million people suffer from asthma. And this 300 million people.
Yeah.
And this is adults and children combined, because we have pediatric asthma and we do have adult asthma. And the burden of this disease is even more in low and middle income countries. And we fall under that category of countries, correct? And 96% of the deaths that are asthma related actually occur in low and middle income countries.
Okay.
So there's actually a call to action for us as healthcare workers to ensure that we are providing the necessary care that is needed by these patients.
Yeah.
We ensure that our patients are coming in for clinics and we ensure that they are being followed up appropriately.
Yeah.
Correct. So as much as we're saying that asthma is a chronic disease, it is manageable.
Okay.
And that is the beauty about it.
Yeah.
It is manageable.
I love that.
Correct.
So we'll be talking about the management of asthma, which is very important.
Yes.
But maybe let's just start from in layman's language.
Yes.
What is asthma?
Correct. Okay, good. So I'll first start by saying, like you had shown correctly in the video, asthma is a disease of the respiratory tract system. So we have the main pipe, let me call it a pipe, because technically it's a network of pipes in layman's terms. So you have, I think when we were in class 5 and we were doing science, we were told that we breathe through the windpipe, right?
Yeah.
If you remember science correctly, yes. It was the windpipe, correct.
Yeah.
And the other name for the windpipe is the trachea. So that is the main pipe through which we breathe in.
Okay.
Then we have the right lung and we have the left lung. So then that windpipe divides into two.
Okay.
One goes into the right lung, the other one goes into the left lung.
Okay.
Correct. And after that, the network continues. Whatever breaks into the right, whatever breaks into the left, continues breaking into smaller pipes up until you have the alveoli, whereby air exchange happens.
Okay.
And why is it important to know this? It is because when you look at how asthma develops, it will affect those networks, from the smaller networks to the right bronchi, the left bronchi, and even the trachea. So it is important to understand how the respiratory tract is. Yes.
Okay.
So what really happens in asthma? There are technically around 4 things that 4 changes that occur in our airways that lead to development of asthma.
Okay.
So let us look at a pipe ya maji, a water pipe.
Okay.
So when the pipe is wide enough, water is able to go through, correct?
Yeah.
And it goes through easily without any challenge. But if you make the pipe smaller or thinner, or you introduce a stone inside the pipe, what would happen?
The water won't pass.
The water won't flow as easily, correct? Because I really want to simplify it so that people are able to understand. So as we look at the water in the pipe, let us equate that to air in the airways. It flows very well when the airways are
open.
Wonderful, wonderful, wonderful.
Good student. Good student.
She's getting it right, correct. But when those airways become narrow, it becomes difficult for air to pass through. And that's why you're going to find that people are going to say they're having difficulty breathing. Ninashindwa kupumua ama nina ugumu wa kupumua. So usually there are, let me call them receptors, or there are certain they enable the airway to stay open. They keep the airway open, correct? So technically what happens in asthma is, one, the airway narrows. So you already have a problem, right? The second thing is there are a lot of inflammatory changes that are happening in the airways. Let me give an example. Ukigongwa na kitu na you leave a mark in a fura, correct? Yes. So you already have a narrowed airway, and then there is inflammation in a fura, right? What happens to that airway again? It narrows a bit more, correct? And then usually when you, in the normal setting, there is mucus that is being produced, even in the airways. You know, it will clean the airways. Sometimes even when you cough, unasema, oh, inatoka na kikohozi ama makamasi. In asthma also, the mucus production becomes more. And that even narrows the airway more. So you're having all these factors that are leading to narrowing of the airways.
Okay, I hear you. So from what I'm getting is that asthma would one represent with very difficulty in breathing.
That is correct.
I've heard people saying, nilikuwa na feel ni kama kuna elephant imenikalia kwa kifua. I really couldn't breathe. Now that you understand what exactly asthma is, we're going to take a very short break because it's 9 in the AM. So you're going to take a very short break and then we'll be coming right back. So if you have any question that you'd love to get answered, anything about asthma, anything about how asthma presents, or you know, probably you have asthma and you'd love to know how it's managed or what you can do about it, this is the platform. And for that, our numbers are very open. That is 0721 105 105. Or you can also text us through our SMS number, which is absolutely free of charge. That is 23814 23814. We're live on Facebook on MBCI TV Facebook page. We're live on YouTube on MBCI TV official YouTube page. So a very short break and then we'll be coming right back. Usiende mbali.
MBCI Television, transforming lives.
Nairobi, a new sound has risen. 96.9 FM, commanding the airwaves, breathing life into every home, a sound of hope, a voice of truth, a well overflowing with living water.
Kuna mipaka tumesukuma, kuna mahali hatukuwa tumefika maeneo katika redio yetu ya MBCI, lakini hayo maeneo sasa Mungu anatupa. Tunaingia Nairobi, tunaingia Mombasa, tunaingia Marindi, tunaingia Ramu.
A station with one divine mission, transforming lives. From soul-stirring worship to life-changing conversations, we speak light into the darkness and faith into the heart of the nation. MBCI Radio, tunabadilisha maisha. Now broadcasting from the heart of Kenya's capital, Nairobi, 96.9 FM and beyond. The sound of heaven, right from where you are. My station, in my city, for revival. MBCI Radio.
Youth of this generation, it is time to rise, rule and reform. Kingdom Seekers Fellowship Nakuru presents the Come Up Hither Youth Prayer Conference, happening from 25th to 29th August 2025, Monday to Friday from 8 a.m. to 5 p.m. daily at Heaven's Gate Prayer Mountain, Nakuru. Join the anointed Apostle John Kimani William,
That God is going to help us to be able to shine.
and Reverend Naomi Kimani.
You can become great, you can go far, you can do many things for God.
As they lead us into powerful sessions of prayer, teaching, and impartation. Get ready to be led into deep worship with Kairu Njunge
We lift your name, Almighty God.
and Frida Muidaga. This year's theme is Claiming the Heights, based on Joshua 14:12. Give me this mountain. Entry is only 500 shillings, and yes, it is worth every moment of transformation. Scan the QR code and register now. Let nothing hold you back from your divine elevation. Mark your calendar, invite a friend, and prepare to experience a new dimension of faith and power. Come up hither, because your mountain is waiting. Rise, rule, reform.
Welcome to Goshen Medical and Technical College, Thika, where dreams become reality and futures are empowered. At Goshen, we offer a wide range of courses in both medical and technical fields designed to meet your aspirations. Medical courses such as clinical medicine and surgery, perioperative theater technology, orthopedic and trauma medicine, health support, community health, nursing, and many more. For applied sciences, we have applied biology, science laboratory technology, analytical chemistry, environmental science, medical engineering, industrial chemistry. For technical courses, we have plumbing technology, electrical engineering, medical office administration, food and beverage production, hairdressing and beauty therapy, and many more courses that will prepare you for the current job market. Our students receive hands-on experience through industrial attachment, which is organized by the college to ensure valuable technical skills. Goshen College is conveniently located at Thika Makongeni, right off Garissa Highway behind Leather Industries. For more information, contact us on 0750-264-044.
Nairobi City, are you ready? The heavens are stirring. A move of God is unfolding. Kingdom Seekers Fellowship Eastern Bypass brings forth Revival Fire Conference 2025. This is not just a gathering, it's a divine appointment. A sound is rising, a fire is burning, revival is here. Lives will be changed, generations will be marked. You cannot afford to miss this. Mark the dates from the 20th to the 24th of August 2025. Time 10 a.m. to 7 p.m. Venue Kingdom Seekers Fellowship Eastern Bypass, Nairobi. Guest ministers Apostle John Kimani William, MBCI Director, Bishop Jim Wando, Apostle Dennis Wambugu, Bishop Moses Mbugwa, and Pastor T. Mwangi, Pastor Raphael R.K. Andho, together with other anointed gospel ministers, will be ministering and usher in God's presence. Your host, Reverend Simon and Pastor Ann Mwangi. For more information, call 0721 321 470 or 0724 008758. Mark your calendar, lock the dates. See you there. Your encounter is waiting.
MBCI Television, transforming lives.
We're back. Thank you so much for staying. This is MBCI TV ambapo tunabadilisha maisha by the grace of God, and we are happy to have you on board. Thank you so much for choosing to watch MBCI TV, where we transform lives by the grace of God. This is Afya Clinic, where we get to talk about everything that concerns your health. Yeah, and today we're talking about asthma. So we said before, if you have any questions that you'd love to ask, this is the place. So feel free, and we'll be happy to get back to you. Today we are having Dr. Sylvia from Valley Hospital right here in Nakuru, and she's ready to share some wisdom, about a lot of wisdom, in fact, as she has already, about asthma. So anything you'd want to know, she is the best person to talk to you. Now, we've defined what asthma is in layman's language, and I love how you've compared that to pipe ya maji. You know, that's something that all of us would get to know what that is. So what are some of the very common symptoms? Zenye ukiona unajua this is asthma.
All right. So I think one of the most common symptoms is wheezing. And what people come and tell you, especially for the pediatric, for the children, is kuna sauti inatoka kwa kifua, right? And you're even able to pick it because you hear how someone is breathing.
Okay.
And the reason that wheeze occurs is because there is airway constriction, right?
Yeah.
Correct. So it's instead of it passing normally and flowing normally, because there's narrowing. So narrowing in medical terms, we'll call it constriction.
Okay.
And because it is the airway linings that are narrowing, we call it bronchoconstriction.
Okay.
Yes, but let's call it narrowing for purposes conversation.
Yeah.
So it is because of that narrowing. Correct.
Okay.
Another common sign that people come with is difficulty in breathing.
Yeah.
Again, it is simply because of the airway narrowing.
Okay.
Yeah. There are patients who will present with chest pain. Correct. There are people who will say they're waking up at night. They're not able to breathe.
Yeah.
They have to wake up and catch a breath. There are people who will probably walk up the stairs and say that they're having difficulty in breathing. There are those who will present with a cough.
Yeah.
And if you have any infection, underlying infection, of course you expect that people are going to present with fever.
Okay.
Correct. Yes. In severe cases, you'll have people having their oxygen levels go down, and therefore some people might actually require oxygen to support their saturation levels.
Okay.
And they're actually very, very bad, severe cases whereby someone just goes into a full-blown attack, that the airways have narrowed so much. And some of these patients, we actually have to intubate them. We put in a tube for them, and they breathe on a machine, on a ventilator.
Okay.
Correct.
Okay.
So it can be acute, and it can also be fatal in some cases. Correct.
Okay.
Yeah.
I hear you. Now we'll be talking about at what point does it get third fatal. But maybe before we do that, you had mentioned there's asthma for the adults.
Yes.
And for the kids. How different is it?
So it is not different. It is that one is happening in the kid population, and this other one is happening in the adult population.
Okay.
But if you look at how it develops, what is happening to the airways, and how we manage, it is pretty much the same.
Okay.
Correct.
Okay. So what are the common causes of asthma?
So like, Asthma sometimes runs in families, so there's a genetic component to it.
Yeah.
And probably if your dad or if your mother has asthma, you might find that is also translated to the children.
Okay.
There are other, let me call them confounding factors that will come in. For example, if you smoke cigarettes, this is especially in the adult population, because then there are changes that are occurring in the airways that can predispose you to getting asthma. When you talk about allergens, dust, watu wanasema baridi. I used to work in a county whereby everything was attributed to the cold because it was a cold region. You're talking about dust, sometimes even blankets because of the material that they are made with. So people have to be careful about some of these allergens, and you need to know about them. Some of this you cannot prevent, for example, dust, right? And when the weather changes, but things like cigarette smoking, obesity, you're quite big, those are modifiable. Yeah, correct.
Okay.
Sometimes you can also find infections can predispose you to this, and they'll actually make the asthma become worse.
Okay.
Yeah.
So what kind of infections are these?
They can both be bacterial and viral. So you might have a common cold, and your asthma symptoms become worse. You might get a pneumonia. Your asthma symptoms become worse. Correct.
Okay.
Yeah.
I hear you. Now, let's get into the vox pops so that we hear what people know about asthma. As you said, especially for the people who've seen asthma in other people or presenting in other people, they pretty much know asthma for wa alifaint, hakuwa anaweza kubreathe. So you need to know, do you know enough about asthma? Is there anything extra that you need to know that would help you or help a friend or a family member in case of an asthma attack? So let's get to the vox pops and then we'll be coming right back.
Okay, what I know ni allergies ka baridi na labda vumbi.
One of the causes ya asthma ni genes inaweza kuwa genetically transferred. Maybe watu wenyu wanapatanga hizo asthma, so unaweza pata because of that. Ingine I think environmental factors. Tuseme for example, maybe sijui kama ni kwa vumbi ama ni baridi, one of the two sana inaweza cause asthma pia.
So in my own view, ningesema maybe mtu anaweza shindwa kupumua dust, maybe dusty places, dusty environment. Yeah, another thing, maybe another cause, maybe I can say about maybe depression, stress. Naweza kuja sasa ni kupe shocking news, kupate by surprise, ujipate like yeah. So maybe you can say depression, dusty areas. Another thing, maybe bad diseases. Napata mse maybe akona that cough, ile diseases. Yeah.
All right, we're back, and there's something very interesting that a guy has said. That first, let's start with the first guy.
Yes.
Please say something about that.
Yeah. He was right on point.
Yeah.
Genetics, environmental triggers. So I have actually really loved that response.
Yeah.
That is actually an educated response.
Yeah.
Correct.
I love that.
Yeah.
And it's how he said, baridi ama vumbi, whatever, one of the two.
He got it right.
Yeah. But maybe we need to know exactly what causes what, so that we'll be able to know what exactly to do. But as you said, we are just chenye anasema.
Correct.
Now the second guy has mentioned depression, stress, and I have so many questions.
Okay.
How is stress related to asthma?
So it is a precipitant. So you maybe probably already have asthma, and in those stressful moments, there are hormones that are released by the body to counteract that stress, and these hormones might actually influence and carry out some changes in the airways. So technically, it is not directly linked to asthma causation, but it can trigger or it can precipitate an attack. Yeah.
Okay.
So he's not far off, it is that it can be a trigger as opposed to it being an underlying causative factor for asthma.
Okay.
Correct.
Okay. I hear you. Now, we've talked about how you'd be able to know, or rather some of the symptoms of asthma.
Yeah.
And we've talked about the risk factors.
Yes.
And you've mentioned risk factors kama baridi, and that I would say is what people know mostly.
Yes.
We've talked about other allergens like dust.
Yes.
So how would you be able to differentiate one from the other? Kama niko na asthma, are all these allergens something that would affect me? Ama naweza kuwa na asthma and vumbi haini affect but baridi inani affect. Is it different?
It varies from patient to patient.
Yeah.
It is not cast in stone for everybody. Everybody has different triggers for different allergens that would make their symptoms worse. Correct. So it's not cast in stone for everybody, but of course commonly it's dust, changes in the environment. Sometimes also stress, like he rightfully said, can actually make existing symptoms worse.
Yeah. How would you know the difference? How would you know what triggers you as a person?
Usually patients do know. They will tell you, even when they come for assessment, they'll probably tell you, I was in a dusty space, or they're having, when people say you're having a fever and a cough, then your mind switches to probably this is an infection. I have a running nose, I'm having a headache, probably from having your sinuses infected as well. So you can be able to tease out what exactly is making underlying symptoms worse from baseline.
Okay, perfect. Now there's a very interesting question here, and every time we talk about asthma, we don't really talk about diet. You're like, but I see someone is asking, lifestyle habits such as diet and exercises, can they trigger asthma?
All right, so diet will come into play when you're having obesity. Correct. So there's usually a measurement that is called your body mass index. I think you've heard people commonly say BMI, whereby you look at your weight and your height. So technically for your height, how much should you weigh? And so really diet is not directly linked, but when you are obese, that is a precipitating factor that can make you your underlying symptoms worse. There's actually a variant of asthma called exercise-induced asthma. Correct. So I like that question has been shot out. And it's actually one of the triggers that can make underlying symptoms worse. But then again, how that would come about is if you're actively exercising and then you go into an attack. Because when you're exercising, your oxygen demand levels go high. Correct. Yes, and that might overwhelm your underlying symptoms, and it makes it worse. So they can be precipitating factors, but not for everybody. Correct. Yes.
So it's very unique to every patient.
Correct.
Yes. Works well. Now, do we have a group of people that are highly or mostly at risk of getting asthma? Do you have a people that would say you are at a very high risk of getting asthma?
So if your family, there's a family history, then you'd be at a higher risk, right? As opposed to probably someone who doesn't have a family history for the same. Again, if you're having some lifestyle issues, let us say cigarette smoking, obesity, so those can increase your likelihood of obtaining asthma. Correct. Yes.
Okay, so it's more of the causes of asthma.
Yes. Correct.
All right, I hear you. Now, this is the best part of it.
Yes.
Because we said, as much as it could be a very serious disease, there's always hope. So let's talk about the management. But first, is there a treatment? Would someone, say, especially for kids, outgrow asthma?
Let me say this. I think we've we've commonly heard those stories of, you know, I had asthma, I outgrew it. The truth of the matter is asthma is about management. Just like we talk about our non-communicable diseases such as diabetes and hypertension, it is about getting the proper treatment. You adhere to the treatment and you're followed up by the doctor. Correct. Like I had alluded before, asthma is manageable. And even on the video shown, there has been an evolution in how asthma is treated. And I think one of the fears or one of the concerns that patients have, both adults and children, is use of inhalers, right? Because the standard treatment is inhalers. I know out there, you know, people are saying you don't need to use inhalers. There's a lot of stigma around inhalers. And it is important that we demystify that and actually pass the benefit of using inhalers to our patients. Correct.
Okay. Why is it that there's a lot of stigma around the usage of inhalers and the disease?
And the disease itself, correct, because I think, you know, breathing comes naturally, right? We should be able to breathe. And when, you know, when people see you not breathing and they really don't understand why you're having difficulty in breathing, people fear what they do not understand. And it's important to pass that knowledge to the public and also to the patients who are ailing from this treatment. I think also, you know, I don't think people are very confident even, you know, carrying an inhaler or using it in front of people, simply because why do you need additional medication to breathe? Why do you need an item to enable your airways to open up? So I think it's just fear of not understanding what really happens in asthma and not understanding as well how asthma should be treated.
Okay. I hear you. I'm hoping and praying by the time tunamaliza issue you'll be able to know that it is not a deadly disease and it's okay. As long as you're able to manage it and live well, then we're good. The issue of having stigma surrounding different conditions, you're not even able to treat it. Not to digress, but was it 2 months ago, the Mental Health Awareness Month? We're talking about mental health, and we said the reason why we're not able to get to a place where we say we are a nation that is well in terms of mental wellness is that we have a lot of stigma that surrounds mental health.
Correct.
So we're not able to kuja on air niseme, by the way, I don't think I'm mentally well, mtanipeleka hospitali, and surely I just need someone to talk to. You know.
Correct.
So we need to get to a place where we don't have stigma around such diseases like asthma. So we'll be getting to that. But let's talk about the management.
Correct. So there are guidelines that have been developed. Actually, there is a global initiative for asthma. It's called GINA, Global Initiative for Asthma. And one of the reasons this body exists is to direct or guide us worldwide on how we should manage patients who suffer from asthma. I would like to point out that for asthma management, there are 2 goals. First, you want to ensure that if someone has an acute attack, they are able to come out of it. And the second thing is you want to reduce the number of attacks that someone gets. And that guides the medication that is used. Yes. So you want to handle the attack that happens, and you want to ensure that you reduce the number of attacks. And that is why then we come to the inhalers, right? Correct. Like I had alluded to before, there are receptors that keep the airway open. Right? Correct. And the medication that is in the inhalers, one of them is to act on those receptors so that they keep the airway open. So there are 2 types. One is a short-acting agent, and one is a long-acting agent. So the short-acting agent should help you immediately you are having an attack, because there is immediate airway narrowing, and you want to ensure that it opens up. Then the long-acting one ensures that that opened airway stays open, so that you reduce the number of attacks that a patient is going to have. Correct.
Okay.
Yes.
So are they different, or the short-acting agent and the long-acting agent, are they in the same inhaler, or we need different inhalers for both?
Good question, and I like that you asked that. So usually there are two different inhalers. I think what commonly people know is Ventolin, right? And what we have here is Ventolin.
Okay.
It is Ventolin. Correct. So this is actually Ventolin. This is Ventolin. So Ventolin is for acute attacks.
Okay.
Correct. And there has been so much over-reliance on Ventolin, but I will explain that later as to why we are not advocating for Ventolin as an everyday drug use. Because the medication that is contained in Ventolin is a short-acting drug. Then you have other inhalers. I know there are some that look like Ventolin, and there are others that are modeled differently, simply because of use. And for that second inhaler, it contains two drugs. It contains a long-acting agent, and it also contains a steroid. And the steroid is to combat the airway inflammatory changes that have happened, to reduce on the mucus production, so that you're able to keep the airway open. And that is why that combination is used. So you have a drug that is keeping the pipe open for a longer period of time, and you also have another drug that is combating the effects of inflammation, mucus production, and ultimately, what is the outcome? You want to reduce the number of attacks that a patient is having.
All right.
Yes.
All right. I hear you. So how would you know the difference between these two inhalers? Assuming I have someone, or I'm working with a friend who has asthma, and they get an attack. How will I know hii inhaler konayo, I'm supposed to use it now, ama hii inhaler konayo nikitumia, it's gonna be bad?
So usually, first off, when they come in, you will have the medication. I think I can show
Maybe we can have, we'll have someone who will be zooming in.
Yeah, correct. So the medication will be written. And commonly, patients, so the medication will be written there.
Okay.
Correct. So you will be able to know. Correct. So, and even commonly, patients will carry the inhalers. Yes. They will carry the inhalers.
So the inhaler that they carry, is it the one that you use immediately?
Or is it the everyday use one? So people are different. Because you see the everyday one, you'll either be told take a puff in the morning, take a puff in the evening, or take 2 puffs in the morning and take 2 puffs in the evening. So depending on how good the control is, the regimen is going to be different from patient to patient. But more commonly, you will always find that people are always with Ventolin in case of an acute attack. In case of an acute attack.
So you've mentioned that it's not very good to kuitumia sana. Why is that?
So like I had alluded before, Ventolin is a short-acting drug. So what happens is, when you take in the drug, the receptors in the airway, they have to, let me say, they have to come up. Lazima zitokeleze, so that they're able to take in the drug and open up the airway. And once they have done that, the receptors go back. Let me say, they go back in. For understanding purposes, all right? So when you use Ventolin as your everyday drug, so that means that every time your receptors are coming up, 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 every time. And when time continues, they will no longer be able to take up the medication.
Yeah.
And therefore, you will use Ventolin, you use Ventolin, you're not getting any relief.
Yeah.
Correct.
Okay.
And that's why we advocate for the use of the second inhaler, which is a daily drug.
Okay.
Yes.
Okay. I hear you. Now, for the sake of the people who are seeing it for the very first time,
yes,
maybe you can just take us through how it's used.
Okay.
Okay.
All
Go
right.
ahead.
Okay.
Yeah.
So this is an inhaler. This is an inhaler.
Yeah.
And they're usually made in different ways. So you'll find that for adults, because it is easy for us to give instructions on how they can use an inhaler,
Yeah.
they don't have an item that we call a spacer. So for children, you'll realize that there is a long, let me call it a plastic item that connects the inhaler to the child's mouth. Correct. But
And why is that?
It is because they're not able to take in breaths. So it's difficult for kids to follow instructions, correct? So for medication delivery, then we use a spacer.
Okay.
But for adults, since we're able to give instruction, then they don't need to use a spacer.
Okay.
But for, let me say, adults, the elderly ones, they are those who we actually recommend that they use a spacer.
Okay.
Just like young kids, correct?
Okay.
Yes. So you're supposed to take a deep breath in and out.
But they're not able to breathe.
So you breathe in and out. Like if you're having your everyday use inhaler. So you breathe in and out, taking a deep breath in and out. Then you open the inhaler. There's a delivery device. And for some inhalers, they actually show you the number of doses that are in the drug. And most commonly, they're around 60 doses.
Okay.
So if you take in 2 puffs in the morning, 2 puffs in the evening, we do know that in a month, your inhaler should be over, right?
Yeah.
So if you come at the 2nd week, I expect that you should be halfway through your doses, and I see you are at 10, then I know they are missed doses.
Yeah.
Correct. And if you come in probably also midweek, and the inhaler is over, then the doctor has to ask questions around how you're using an inhaler. There is an episode of House, I don't know whether you've ever watched House, whereby a lady comes and says, my asthma is not getting better. So she's saying, my asthma is not getting better.
Okay.
And Dr. House tells her, can you kindly show me how to use the inhaler? She opens it up, sprays at the side of the neck.
Surely.
Correct. And her complaint is, my asthma is not getting better. But is the medication going where it is supposed to be going? Not at all.
Yeah.
Correct. So we go back. You need to ensure that the mouthpiece is completely inserted inside your mouth.
Okay.
So you seal the mouthpiece so that medication doesn't get out. It doesn't seep into the air.
Okay.
So you seal it completely. Sealed completely.
Okay.
Yes, of course, inhalers are not for sharing.
Yes.
Correct. At the top, there is always, when you press here, that is how the drug is delivered.
Okay.
Correct. So I first want to explain, then do it.
Okay.
So you will press, and the drug will be delivered. And you will breathe in.
Okay.
You will breathe in, and you will hold that breath for 5 seconds. So you count to 5, 5, 4, 3, 2, 1, and you breathe out.
Okay. So it's like taking in the medicine.
You take in the medicine actively. All right, so let's see. I hope I'll be able to do it right.
So you'll actually use the...
Yes, this is my
side
drug.
effects? Do we have an ambulance anywhere?
No, this is my drug.
Okay.
Right, so we've said completely sealed. And you breathe out. So usually, if the technique is not right, you will see white gas from my mouth because there is leakage of medication.
Okay.
Correct.
Okay.
So it has to be a very tight seal. You do it right. You deliver the medication. Take in a deep breath. Count it down for 5 seconds. Then you breathe out. Correct.
I see.
One of the things I can also point out, especially for the second inhaler, the steroid can bring changes to your voice. So most doctors advise, once you're done doing your puff in the morning, your puff in the evening, or your 2 puffs in the morning, your 2 puffs in the evening, you gargle some water and you throw it out. Otherwise, you'll be walking in the streets croaking like I do. Mine just comes naturally. It is not
So it's
because
not a side effect?
it is not a side effect from any medication. Correct.
Okay. Now, we'll be taking a look at some of the myths that surrounds asthma.
Asthma, yes.
But before we do that, maybe we just get to know do we have any side effects of the inhalers?
So the reason the inhalers were chosen is because it's the most safe and effective way of delivering medication. Because it is going straight into your airways. Correct. And when you have, even I know, there's been a lot of talk about steroids and their side effects. But when you're inhaling it, it's actually the side effects are not as bad. Apart from what I've told you, the hoarseness of the voice simply because of the steroid, there's a workaround towards that. Correct.
Okay. I hear you. Now let's take a look at some of the myths that surrounds asthma, and if you've heard of any other, assuming you've now learned about asthma, or you've heard about asthma even before this conversation, and you've had a myth that you'd love for us to demystify and let you know if it's true or not, you can always share as well, and we'll be happy to go through it. So for now, let's start with the first myth is that asthma is just a childhood disease. Is it?
So asthma can actually progress into adulthood, and that's why we said we have pediatric asthma cases and we have adult asthma cases. Correct. So it is for both age groups.
Yes. And this sounds like stigma to me.
Correct.
We need to do better.
Yes.
And the second one is that people with asthma should avoid exercise.
Not necessarily. We remember we said that obesity is one of the triggers for asthma. So actually, if you do lose the weight, your asthma symptoms become better. But also remember that there is a variant of asthma that is exercise induced. Not very common, but there are people who get it. And for those, there are guidelines on how they should regulate the amount of exercise that they are doing.
So not avoid completely.
Not avoid.
Just regulate.
Just regulate.
Okay.
Correct.
I hear you. And on the third one is that asthma attacks are only triggered by dust or allergies.
Some of those are triggers. We've talked about infections, obesity, cigarette smoking, stress. So it is partially true. They can be triggered by those 2 items, but those just fall under allergens. There is there are broader triggers for asthma.
Okay. And on the last one is that inhalers are addictive or harmful if used regularly.
I think one of the take-home messages I would like our viewers or whoever has joined in today is that the recommended medication for asthma is use of inhalers. Correct. I know,
and that it's safe.
And it is safe. We need to stop this behavior of giving over-the-counter antihistamines, over-the-counter oral steroids. I know a drug like prednisolone is very common. It is given over-the-counter. But the take-home message is that if you're going to, if you're diagnosed with asthma, the drug of choice is inhalers. Correct.
Okay.
So inhalers are useful.
Yes. Very.
Yes.
And you've showed us how to use it.
Yes.
So now you know. And if you're there and you've probably had, I'm saying this because when I was in high school, that's some years ago.
Yes.
There's a girl who had an asthma attack. Nikiwa karibu naye, and I was completely frozen. I just didn't know what to do.
Correct.
And that's so sad, because assuming it gets to a very serious, it gets very serious.
Yeah.
Nakula inhale hapo, and I can't do anything.
Yeah.
So it's very important for all of us to know what exactly you're supposed to do and how you'd help this particular person. Yeah. So we have Shiro and Oliza. I'm asthmatic. And I do use an inhaler. Can it affect my pregnancy?
So I think that is a very good question, because even for pregnant women, inhalers are recommended, safe for pregnancy.
Okay.
Correct.
Okay.
When you start going with the oral medications that are given over the counter, some of them can actually harm the child. Correct.
Okay.
And I wish her the best in her pregnancy, and let her continue doing her clinics with the attending physician and obstetrician gynecologist.
Okay.
Yeah.
Perfect. All the best in your pregnancy. And it's safe. Remember, it's safe.
Correct.
Now, let's take a look at healthy living prepared by Sylvia Wandra, and then we'll be coming right back to wind up. So if you have any question, please feel free. Hoping that we'll have enough time to answer all the questions. But for now, let's get healthy living.
Welcome to Afya Clinic. Today, we talk about asthma, a common condition that affects the lungs and makes it hard to breathe. Asthma happens when the airways become narrow and inflamed, causing symptoms like coughing, wheezing, chest tightness, and shortness of breath. These symptoms can come and go, and sometimes they become worse during the night and early in the morning. There are many things that can trigger asthma attacks. These include dust, smoke, strong perfumes, cold air, pollen, pet dander, and even respiratory infections like the flu or common cold. Stress and too much physical exertion can also trigger attacks. So, how can we manage asthma and live healthy? First, know your triggers and avoid them as much as possible. Second, take your medication exactly as prescribed by your doctor and never stop using your inhaler or medicine without medical advice. Third, keep your environment clean. Reduce dust, mold, and smoke in your home. Fourth, live a healthy lifestyle. Eat a balanced diet, exercise moderately, and get enough rest. And lastly, always have an asthma action plan so you can know what to do during an attack. Remember, asthma has no cure, but with the right care and treatment, you can live a full, active, and healthy life.
All right, you're back. So that is it. Thank you so much, Sylvia, for that particular segment. That was amazing. We have one person who's asking, and anasema, praise God, Rachel. Amen. And anasema, Vicky here from Eldoret. Does asthma come with allergies? Because I have asthma, but iko na homa yenye haishi.
So she does have asthma, and what makes her symptoms worse is the exposure to the allergen.
Yeah.
So let's say I would not maybe call it homa haishi. I think it is that her control might not be very good, and that is why she's getting some repeated symptoms. So I would probably want to know how long she's had asthma, what inhalers she's using, how she's being followed up on. So my advice to her would be to visit her nearest health facility and have a doctor assess her. She might just be using Ventolin alone, and therefore the symptoms are not getting better. So her treatment plan needs to be adjusted. And I like that the video has said every patient has an action plan. So probably her action plan on asthma management needs to be relooked and if possible revised.
Okay. Yeah. And Oliza, how does a brown inhaler work, or what does it mean?
What?
A brown inhaler. Brown inhaler.
Oh, brown.
Yeah. B-R-O-U-N.
So usually you see different companies have different inhalers.
Okay.
But what is important, and that is the message, is the medication that is contained in them. Because inhalers all work in the same way, right?
Yeah.
Correct. So what would differentiate is the companies that are producing it, but the other thing that is important is the drugs that are in it. We've talked about the second inhaler, which has a combination of 2 drugs, which is technically your everyday drug use. So there is no difference in how the inhalers work. It is important to know how it is used and the medication being delivered. Correct.
Okay.
Yeah.
Perfect. Anasema, hello Kahugu, hi. And so my child has asthma. What should I look out for? Okay.
All right. So if her child has asthma, even like the video has said, know the triggers.
Yeah.
Correct. Is it dust? Cold? Are they getting repeated infections?
Yeah.
Correct. Because even pediatric asthma is managed very well. And of course, I would advise that she sees the pediatrician just to assess the child. If there are any adjustments that need to be made, they are made.
Yeah.
It's about managing and controlling. That is the most important thing, because a child can live a very comfortable life without needing multiple admissions in hospital.
Yeah. I think that's very important. I see there's someone who've asked about children outgrowing asthma. I know you had mentioned about it, but maybe just go through it again.
So usually it's about management, as long as the symptoms are managed, because even when we are classifying control of asthma, there are children or adults who are well managed. That means that they are not getting any symptoms, because there's a way you look at them. Then there are those who are partly managed. Those ones, they get 2 to 3 symptoms, and you're assessing this as in a week's time. Are they having any limitation of activity in the morning? Are they having worsening of symptoms? So, and there are those who are uncontrolled, meaning that they are getting repeated attacks within the week. So it is about how well controlled the disease is. Correct. Because there are people who will come, they've not used the inhaler in 1 week or 2 weeks, simply because the symptoms got better and they said, mimi nimepona. Then the next time they land in a hospital, they're actually in a very bad exacerbation. They have to, you have to use the nebulizer to try and open them up. So people really need to be cautious when they use terminologies like outgrowing asthma. What we would want to say is either your asthma is well controlled, it's partly controlled, or it's uncontrolled. And based on that, then you can come up with a very good action plan with your doctor.
I love that. We have Lizzie saying, say hi to my HOD, Dr. Sylvia.
Oh, wow.
Yeah.
Thank you.
All right. Now, I know that we're short of time, but maybe let's just talk about what are the most important things that an asthma patient should look out for.
Good. Perfect. So, the first thing is, know the symptoms, right? Patient education, extremely important. We want people to know that, these are the signs and symptoms of asthma, so that you even yourself, you're able to say, hey, today I'm not feeling, I'm having, chest tightness, I'm feeling like I'm getting some difficulty in breathing. It's important to be able to recognize that. As you have rightly pointed out in the video, know the triggers. And it's good to know all of them, because like we said, they vary from individual to individual. Correct.
Okay.
The other thing I really want to emphasize is hospital visits. I know if you're not unwell, the likelihood of you visiting a hospital, if your symptoms are controlled, is next to nil, right? Correct, yes. But it is important. Just come and talk with your doctor, because that's when the assessment is done. That's when the reviews are done. Then, drug doses can be adjusted as needed. But let's say you are taking 2 puffs, every 2 puffs, morning and evening, but because your symptoms are getting better or you're better controlled, we might adjust that symptom. You might adjust the medication to 1 puff in the morning or 1 puff in the evening. Correct.
Okay. Yeah, I hear you. Maybe we take this as the last question so that we'd have Brenda taking us through the tips. And Eliza, is it true that asthma is contagious?
So asthma is not contagious. It is not airborne. Correct. It is not like viral infections or TB or COVID, right? you know, anything that we can get in the air, that's what we're saying is airborne. But if you look at what we have discussed about how asthma comes about, we've not talked about it being a bacterial, a viral infection that you pick from the environment. So it is not contagious. It can be hereditary, it can run in families, but there are other underlying pathologies that actually lead to asthma coming about. But people should not wear masks fearing that they are going to contract asthma from others. Yeah, correct.
Okay. What would be your parting shots?
Asthma is manageable, and it is important to realize and acknowledge that, you know, people have asthma. We need to stop stigmatizing those who have the disease. We need to be supportive. You know, you had said that, you know, we are having a lot of mental health issues coming about. If we stigmatize people with certain diseases, we're actually making their mental health worse, right? And most importantly, this is the recommended treatment for asthma. Kindly let us not dispense over-the-counter pills, antihistamines, corticosteroids. We are actually harming our patients in the long run. And, you know, kindly come to hospital, be reviewed, talk to your doctor, let the doctor comprehensively assess you, and you agree on an action plan. Correct.
Okay.
Yes.
Perfect. That's amazing. Now, for the people who would love to have more conversation, maybe come get checked and probably bring their kids, their friends who might be having asthma. Watakupata wapi?
So we're very happy to first have them in our facility and take care of them. I represent a hospital called Valley Hospital. It's located on West Road, just opposite Ole Ken Hotel, and it is also next to Waterback Hotel. And we really pride ourselves in providing care that can be trusted by our patients. So in case of any queries, in case of any checkups, we have our physician clinics that run. We have pediatric clinics that run. So both adults and children can feel very comfortable coming to us and getting the services that they need. Maybe I can add on that we also have a functioning accident and emergency unit. So for those who get any acute attacks and need to be attended to as an emergency, they can comfortably walk into accident and emergency, and they will get the care that they require.
Okay. Yes. I love that. You know, I said it the other time. I have a personal experience with Valley Hospital. No, this is a very personal. This is a Kahugu version. So I have a very personal experience with Valley Hospital. My sweet grandma had her surgery in Valley Hospital, and it was amazing. So I'm very pity. I told you. So I'm very particular with, I don't want that, I don't want this. But in Valley, I absolutely loved everything, from the reception to how you guys were taking care of her. You know, dile tu tunataka tupone, but hey, that would be an amazing, amazing place for anyone. So I absolutely love the place, and thank you so much for coming.
Thank you very much.
Maybe just remind the people where it's located.
So we are located on West Road. I think we have a new building that really stands out there. Correct. You will see it in very nice red and blue colors. This is right opposite Ole Ken Hotel, and it is next to Waterback.
Okay.
Correct.
Okay, perfect. So for the people who would want to reach out, I believe there's a number.
Yes, there is a number.
Maybe I can just read out the number, and of course we'll have it on the screen, so it's on the screen already. So if you want to make a call, that's the number. That is 011 051 820. 011 051 820. So please make the call, and I'm sure that you'll be able to get help. I love that they've said you get they are able to take care of you very beautifully, so that it's curated to your personal needs, and you'll get well. All right. So thank you so much for coming, Doc. Thank you for having this conversation with us. We say this is where we get to talk about every health condition in a way that you're able to understand, because health is very, very important to each and every one of us. So we can only do so much. So the other thing you're supposed to do is for you to take that step and decide, you know what, I'll go to hospital, I'll go get checked. Yeah, because surely they can't come to your home. So don't go time yenye imekuwa ni mbaya sana, you're in a critical condition. We say that early detection is very, very important, and we say that while starting. So if you're there, you're feeling kuna symptoms kidogo hapa na pale, ni kama you're not okay, don't be the normal Kenyans that we are wa Dr. Google. Go get checked. Okay, so thank you so much for being here as well. I know that we've had a very long ride from 7:30 where we started with music, we got into a bit of conversation, got to see what you're thanking God for, and of course got into the discussion where we're talking about asthma. And I know that in every stage you've gotten to get transformed, because that is what we do. And as we wind up, we'll be having Brenda. We'll get to know if you're ready. Yeah, so we'll be having Brenda, and of course with Brenda atakuwa natupea some of the tips, yeah, or the take homes, what you've gotten from today's conversation. And now that means that tutakuwa tumefunga chapter ya kwanza. Asante sana for coming.
Thank you so much for having me. It was an honor and a pleasure to be seated here today and talk about asthma. And it is my hope that we've been able to demystify some truths, some rumors and facts about the disease.
For sure. Perfect. Now, we'd get the did you know as we prepare to get the tips. So let's get the did you know segment. Of course, unajua with the did you know is that what we do is we jog our minds kidogo. We've had a whole conversation, and a very heavy, intense conversation about asthma, what it is, how it happens, and all that. So let's get the did you know as we prepare to have Brenda on set. Hey. So the did you know today? Did you know that music can reduce? And I need, is it glasses or carrots? Because what is this I'm doing with my eyes every time I have to read something on the screen. So, did you know that music can reduce anxiety and even help plants grow faster? Did you guys know that? That music can actually reduce anxiety and help plants grow faster. But plants, really? Did you know that?
Yeah.
Oh, you did?
I did. I had some plants. It was an experiment done that when a plant was placed in a place that had all the necessary nutrients and the light to grow, and another one was placed at a place where it had everything, but what they did different is they placed music there.
I think you've told me that before.
No.
Me. Who said that?
It wasn't me.
Yeah, but I've had that before.
But I've had it. It was an experiment that was actually done.
Okay.
Yeah.
Okay. Perfect. So we're now having Brenda on set. Of course, we've had Dr. Sylvia, who's taken us through the whole discussion just to get to know what asthma is. And now from Brenda, we'd love to know what are some of the take-homes that you've had. Yeah. Please go ahead.
And so for our first pointer is that almost around, that is about 300 million people worldwide suffer from asthma, affecting both adults and children. And that is about 1 in every 30 people suffer from asthma.
Oga?
Yeah.
Okay.
Yeah.
Something.
That's about one in 30 people.
Yeah.
And yeah, that is something that is really getting attention. And it's something that we should look to right now.
Yeah.
And the second pointer is that asthma is a respiratory tract disease. Asthma is a chronic respiratory condition caused by airways narrowing. And this airways narrowing could be by production of a lot of mucus and swelling that makes the airways narrow, and that causes breathing problems. And that we will see the symptoms later on. And the next point is that causes include genetic factors, allergens like dust, and I think pollen is also among those. I've read something concerning asthma in the past from those posters you usually see in hospital. And then obesity, smoking, stress, and environmental factors like cold. And asthma can be managed that is the good thing that we have. In as much as you can suffer from asthma, it can be managed, and it can be managed mostly by administering short-term agents and long-term agents. And Doc mentioned a global initiative for asthma, and she said that some of the managing they usually do for asthma is, the first thing they usually do is handling the acute, and the second is reducing the attack, the number of attacks. And the next pointer is that symptoms of asthma include coughing, wheezing, chest tightness, and shortness of breath. And I remember when I'm thinking of those symptoms, I remember in high school there was a girl I used to know. We were in the same form actually, and she would have that asthma, and every time she would have an attack, she would, remove the breathing sounds like, and it will really make me scared.
Like what?
Like she will really struggle. Yeah, the wheezing. And another thing I understood from that is, now looking back to it, I'm understanding that the teachers didn't know how to handle it, because in high school there was movement by running. So you remember those things. And every time she ran, she would struggle, like she will struggle breathing, and that is something that teachers also need to be made aware of, so that they can know how to handle people who get that condition. And also the cold that is in schools. I know that in high school, kuna kwanga na ile don't care sana ya walimu, but this is something that they can look toward people not walking around without sweaters in the morning, and it's in the morning, and kufungua mlango is not really a problem, but the amount of cold that just gets in, it's really questionable. So they should look toward that. And the last point the symptoms the doc mentioned include coughing, that is wheezing, chest tightness, and shortness of breath. But they have said that they are administering short-term agents and long-term agents. She has given an example of, not an example, but she came with what do we call an inhaler. And she has said that is the safest form we can handle.
Treatment.
And that was it for today's pointers. I can't wait to do it next time.
Perfect. So that is it. Thank you so much for being here. Thank you so much, Brenda, for taking us through what you've learned today. I hope that that's something that you will always know, just in case you need to use that knowledge somewhere. All right? So thank you so much for being here. Thank you for being part of this conversation. I believe that you've gotten something from the whole discussion that we've had with Dr. Sylvia, and of course the pointers that we've had with Brenda. Okay? So thank you so much. Have an amazing, amazing rest of the day. Also remember that tunaenda tukikaribia the Come Up Hither conference, the youth conference. Yes, that is right here in Kingdom Seekers Fellowship. So we'll be telling you more about that, but kama wewe ni youth, make sure that unaka ukikwanga ready. As you can see on your screen, is that we have the Come Up Hither Youth Prayer Conference that will be happening from the 25th to the 29th of August. That is next week. From 8 to 5 p.m. daily, Monday to Friday, nitakuwa pale Heaven's Gate. And of course, the theme will be claiming the hates. And it's gonna be amazing. So the charges are only 500 shillings, and I absolutely believe that this will be a conference that would absolutely transform your life, because as you say, that is what we do right here. So nenda pale na najua kwamba utabarikiwa. So if you're a youth, make sure that you are preparing your heart, your mind, and of course your 500 shillings for this particular youth conference. Sawa? God bless you. God be with you. Thank you so much for tuning in today. So I'll see you on this particular show next week, same time, same place. Until then, have an amazing rest of the day. Bye-bye.